We're continuing to review Medicare hospice criteria. So let's talk about diagnosis of stroke or coma. When you're admitted to hospice with a CVA, stroke, or coma, these criteria must be present. The PPS must be 40 or less, and there is an inability to maintain hydration or caloric intake. We see a weight loss of greater than 10% over the past 6 months or 7.5 in the last 3 months. It might mean a low albumin of less than 2.5. In the stroke or CVA patient, there is likely dysphagia with aspiration consequences, and that's inhibiting adequate oral intake. The comatose patient, of course, will not be eating and is not to receive intravenous nutritional support. If the patient has been in a vegetative coma state, meaning this is not a new condition, there needs to be some other criteria. There needs to be shown abnormal brainstem response, an absence of all verbal response, absence of withdrawal from pressure pain points, and a serum creatinine greater than 1.5. Remember, if your patient was admitted with a CVA and it's time to recertify the hospice care, you should be documenting carefully, as Medicare is going to continue to require eligibility using the same criteria for continued care. Show that the patient has declined. Perhaps they had a PPS of 40 and now it's 30. Perhaps they are now bedbound and they had been able to be carefully transferred from bed to chair. Their weight is dropping more precipitously off, and this is due to increased dysphagia. Perhaps there are even episodes of pneumonia for either observed dysphagia, choking, or silent aspiration. The patient has had progressive decline and may demonstrate decreased cognitive function. They're not able to speak anymore, or they can't follow any simple directions. They may have come to hospice with or develop pressure injuries due to their increased inability to move. Although hopefully, if they're already on hospice care, you've been careful to prevent skin breakdown if possible. These patients have increasingly complex care needs. They have incontinence, constipation perhaps, and any symptom of discomfort needs to be looked at. Because they can't tell you what they need, your observation skills are even more put into play. The next video we're going to move on to will be another neurological disease, dementia and Alzheimer's. But remember to visit our website, the Hospice Care Plan. We have information how to manage symptoms for all the major diseases. We teach you how to take care of all of our patients. Go to our website, thehospicecareplan.com, get one of our booklets for a crash course in hospice care, and remember our motto, care is treatment.